While the looting has been confined to 2 provinces, there is concern of a national knock-on effect. The Western Cape says the violence in Gauteng and KwaZulu-Natal poses a significant risk to healthcare provision in that province. The Western Cape, of course, nearing the peak of its 3rd wave. Lindsay Dentlinger has more.
More than 700,000 people in the Western Cape have received at least 1 dose of the COVID-19 vaccine. The province says it can reach a weekly target of 150,000 jabs if it receives more doses.
Our national colleagues are currently considering how to deal with the available vaccine supply in light of this really critical situation in KZN. And the decision has not been made, but if vaccines has to be redirected, it will then be something that is considered to be fairly redirected across other provinces. That's why we are in communication with the National Department around what will unfold when that happens.
But it's not only vaccine supply that could be impacted. The province is drawing up an inventory of products whose supply could be interrupted, including antiretrovirals.
Our team is on top of it, the supply chain team. Our pharmaceutical team is on top of it, also looking at alternatives. But it is there are significant risks for the entire supply chain because of what has happened in KZN.
But the Western Cape says it's also on hand to assist provinces that are in trouble.
We're also busy having a look at, what is it that we can do to help. So we're busy analysing that as well from a health point of view, also from a food point of view. We also need to have a look at that. So that's what disaster management is busy with.
Despite a more than 13% increase in new COVID-19 cases over the last week, provincial health authorities say they don't expect the 3rd wave peak here to be as severe as the 2nd. Lindsay Dentlinger, Cape Town.